Hi guys, welcome to Healthy Living with Nosmo, the channel where health finally makes sense. Okay, welcome to this week. And in this week, we have a very delicate topic to discuss. This week, we're going to look into PCOS. Yes, you got that right. And I did put out the quiz asking about the topic that the condition that starts with P and ends with S, and it is PCOS, and it's a condition that affects women. We're going to be talking about living with PCOS and taking control of your body because it is your body at the end of the day, and we want to take control of it. Now, if you've been told that you have PCOS, you're confused, you're overwhelmed, you're not sure what's happening in your body, this video will kind of help you put it into perspective what's going on in your body, what's causing it, what you can do, and how you can live with PCOS because it's a condition and it doesn't determine how your life is supposed to go. Okay, so you have the power to make the changes that you want. So come with me as we break down what PCOS is all about. PCOS, that is polycystic ovary syndrome. Polycystic ovary syndrome is a common hormonal disorder that affects women of reproductive age. Now, about 10 to 13% of women have been diagnosed with this worldwide, right? And 70% of those women they never knew that they had PCOS. Okay, so you must know that you're not alone in this. All right, it affects women and it is one of the leading cause of infertility in women. Okay. However, we have a lot of women that are living with this condition and have been able to have children over the years, right? But what have they done? What has worked for them? And what works for one person might not work for another, right? And so that's what we want to look into. So let's get into it. Now, how does PCOS happen? PCOS happens when the hormone level is out of balance. And what hormones are we talking about? We're talking about androgens. And these androgens are mainly to maintain male characteristics, right? However, females also have it. We also carry, but when we begin to have it higher than the normal level is when it begins to affect the female, okay, the female body. When it's higher than normal, it can lead to PCOS, right? But we all need this hormone. It's also called the male hormone, right? But we all need it for reproductive health, bone density, and muscle growth, right? However, when it's out of the normal range, that's when it begins to affect the body, and that's what's happening in PCOS. And so when this hormone is being overproduced in the female body, it begins to affect ovulation. And again, when full ovulation is affected, it affects fertility and affects a lot of other things. You begin to see the signs and the symptoms on the characteristics on the female body as well. Because again, like I said, it's mainly for maintenance of male characteristics, right? Okay, and we'll still talk about the signs and symptoms that come with PCOS, but that's what happens in PCOS. Or if they tell you that you have PCOS, that's what's happening. And as I said, these high levels of androgens affect ovulation, and then we begin to see the symptoms. Okay, and these symptoms can vary from for each woman. Okay, it can be different for each woman. All right, and it can change over time. So one of the symptoms that you would see if you have PCOS is absence of periods. Okay, absent periods, irregular periods. Absent period is one. Number two is difficulty getting pregnant. Okay, if you've been diagnosed with infertility as well, that could be a leading cause of it for you as a person. Um, Excess facial hair or body hair. Some women have been known to have beards and they've been known to have hair on their chest or on their arm, and it's just excess. Okay, and that could be as a result of these excessive hormones that have been built up. Okay, and then another symptom is oily skin. Okay, acne or oily skin. Again, there's this overproduction going on. So acne or oily skin is another one, another symptom that we can see in people who have PCOS. Now, hair thinning, hair loss is another one. If you're noticing a combination of two or three of this, you want to see your doctor and you want to make sure that everything is fine. Okay, especially if you've been trying to get pregnant for a while and it's been difficult or it's been delayed, you want to see your doctor and just make sure that everything is fine. Okay, so and these symptoms are caused by again hormonal imbalance, and this lack or problem with ovulation. So hormonal imbalance and problem with ovulation is what's really causing the symptoms to come. And like I said, it varies from woman to woman. What factors play a major role in a woman having PCOS? The number one factor, and I always say this, genetics. We do not play about genetics. Genetics is a very big thing. Okay, if it's in the family, if you likely have a chance of having PCOS. Okay, so genetics is a very big one. Right, family history of PCOS. Now, the second one is again hormonal imbalance. When the hormones are not balanced and they're out of whack, and you're having high levels of hormones being produced. In this case, the androgens, it can lead to PCOS and affect your ovulation, right? Now, women with type 2 diabetes are also at risk of having PCOS. So you see those things, genetics, which is family history, having type 2 diabetes, and also hormonal imbalance can be a risk factor for having PCOS. Okay. And so, if you notice any of these things, if you know that you have it in your history, you have type 2 diabetes, it's important that you stay on top of your health. It's important that you see your doctor and make sure you've done all the necessary testing. And if you're a woman within your reproductive age and you know that you do want kids, yes, see your doctor and let them make sure that everything is well. And if not, you want to start getting treatments and see how you can manage the condition. How do you get diagnosed with PCOS? And like I said before, if you notice, if the doctors can diagnose you, if they notice two or more of the symptoms that we did talk about, right? Again, irregular periods, absent periods is one. High levels of androgens, symptoms of those high levels of androgens, like excess hair, hair loss, hair thinning, oily skin, all of those little symptoms right there are building up. Okay, polycystic ovaries, when they do an ultrasound and they find the those polycystic ovaries, okay, on the ultrasound, that can be a way to diagnose a woman that she has PCOS as well. Okay, so it's not just one thing, but it's a combination of all this symptoms or signs. Okay. Now, another one that they can do is to do a blood test to check if you have normal, higher than normal levels of androgens, that's steroids in the body that's been produced. Okay. If a woman doesn't have like visible hair on her body, or hair loss, or hair thinning, or excessive hair on her body, then they want to do a test to see if there's higher than normal levels of androgen steroids in the woman. Not every woman will have ovarian cysts. Okay, not every woman with PCOS will have ovarian cysts. So that's something to take note of. Again, like I said, it's a combination of these symptoms, signs and symptoms, and also with blood tests being done. As I've always mentioned, that we have the power to take control of our body, right? Whatever we give to our body is what it's going to give back to us. Okay, so with PCOS, we know that there is no cure, but we know that it can be managed and it can be controlled. And we've had women with PCOS who have had children. Okay, it might have taken a while, it might have taken years, it might have taken, a lot of treatments and back and forth, but they finally had their children, right? And they're finally free from, whatever symptoms that they were having as well. It's not just about having the children, but also how it affects them mentally, emotionally, and in every other way. So it's a lifelong condition. And yes, we know it's a lifelong condition. And even though it has no cure, but it can be managed and it can be controlled. So the number one thing, as I usually say, is to make lifestyle changes in every condition, every health condition. It starts with lifestyle changes. That's what we can change. We can't change genetics, we can't change our age, but we can make lifestyle choices that are better for our body. So the number one thing and the first step to take is lifestyle changes. And what are these lifestyle changes? We're talking about eating healthy. Okay, We're talking about eating healthy. We're talking about regular physical activity. I'm not saying overdo it, but I'm saying regular physical activity. And it's to start small and work your way up. Okay, so eat healthy, make healthier choices, healthier options. Okay, very important. Be on it. If you need to see a dietitian, to be on a strict diet just because you know what your goals are for doing it, get on it. Okay, regular physical activity, weight management. You cannot have PCOS and be obese and also have type 2 diabetes. It's like it needs, something has to go, right? And so we need to manage our weight. Okay, we need to manage our weight. Weight management is very important. Try to lose weight. Man, if you have type 2 diabetes, try to manage the your blood sugar, okay, as much as you can. And this would help improve those symptoms. Okay, even even without the weight loss, just eating right, physical activity would improve your symptoms, and adding weight loss to it would, you know, change things drastically and hopefully improve the condition as well. Number two is medications. There are medications that can be taken to treat this condition or to manage this condition. I would say not to treat it, but to manage the condition, and that depends the condition, and that depends on your goal. That depends on your goal because it's different for each woman. Okay, so bed control pills is one medication that you can start with. We did talk about this when we talked about fibroids. There are bed control pills that can be used, and this will help you to regulate your periods. This would reduce acne and the excess hair or the hair loss. It will kind of help with regulating that. That's the bed control pills. Another one is anti-androgen medications. Anti-androgen medications will help to reduce the symptoms of high levels of androgen, which are the excess hair on the body, excess hair loss, and the hair thinning and oily skin and all those things. It will help. So we have bed control pills and we have anti-androgen medications. Those would also help to manage the PCOS. All right. We also, number three is fertility treatments. We have fertility treatments for women who are finding it hard to get pregnant. It could be IVF. It could be all the different options that are available to you. It's your duty to do your research and speak to your provider. But there are fertility treatments, and again, these fertility treatments are there to help you, to provide options to you, and to make things easier for you. I've heard women who say, well, I want to carry my child by myself. Well, I want to get pregnant naturally. And that's great. And if that's the miracle, and if that's the hope that you're having, that's perfect. Okay. And if you want to stick to that, again, that's you. But I'm saying that there are options available to you. There are so many options available to you, and we've had women who have had their miracles and their joy of being a mother, from having IVF, from doing the other fertility treatments that are available to them. Okay. So look into that. And those fertility treatments will help with ovulation. Tracking your menstrual cycle. Track your menstrual cycle is very important. That way you can know when you're ovulating. You can monitor your body. You can monitor what's going on. See the treatments that are working and see if those treatments are actually working for you and what you're doing is working for you. Okay. Track your menstrual cycle. Like I said, staying active, regular physical activity, very important. Very, very, very important. Okay. Get regular checkups, your blood sugar, your health checkups, get regular checkups. Once you've been diagnosed with PCOS, you want to make sure that you're seeing your doctor, they're checking you, they're monitoring you, they're doing everything they can to make sure that this condition is being managed and is under control. Okay. And also, we cannot underestimate the impact of being diagnosed with a condition on our mental health. And like I said, it doesn't mean that anything is wrong with you mentally. It just means that you're seeking help. It means you're taking your mental state and your emotional state priority. You're making it a priority, right? So address any mental health concerns. If you feel like you're being depressed from this condition or from the effects of this condition, it's important that you speak to someone. It's important that you find support systems. Like I always say, sometimes it might not even be therapy. It might just be having the right support system in those moments that, things are very blurry and you don't know, you're overwhelmed with the new condition that you've been diagnosed with. So it's very important that you address whatever effect that this condition is having on you mentally and emotionally, and surround yourself with the right system. The right support system is very important. Surround yourself with the right support system. Now, like we said, that PCOS is the leading cause of infertility. Okay. Now, there are treatments for infertility. Okay. And this treatment for infertility due to PCOS, like I said, include life changes. Okay, lifestyle changes, as I've discussed, medications, surgery, okay, to stimulate the ovulation. There are surgeries that can help to stimulate ovulation, and that's why I said it's up to you to know your condition, to do your research, okay, reliable information. All right. There's IVF. There are women who have gone through IVF, and other assistive reproductive technologies are available. Okay, now that are also being used. Okay, and women with PCOS can be supported to become pregnant. However, they have a higher risk of pregnancy complications. Okay, and so when you do get pregnant and you know that you have PCOS, you need to be monitored. Okay, you need to advocate for yourself. You need to let your doctor know, I want to be monitored. I want to be, I want to have continuous checkup. Make sure that you're advocating for your health, advocating for your body, and taking control of your body. You've only been diagnosed with PCOS. You're not letting it take control of your body, because you own your body and you own the rights to your body, and you're taking control of your body. Okay, and that's what I'm here for, to let you know that you can take control of your body by doing some of the things that I've discussed in this video, okay, and discussing with your doctor, okay, whatever your goals are. Even if you've been diagnosed with PCOS, know that it can be attainable. Know that you need to give yourself some grace and be patient, okay. All right, and so we've come to the end of this series, okay. We discussed PCOS. We talked about what's causing PCOS. We talked about the symptoms. We talked about the risk factors, right? How we can diagnose PCOS. And we really talked about living with PCOS, because, again, it's a lifelong condition, no cure, but it can be managed and it can be controlled. And you have a right to take care of your body and to take charge and control of your body. Okay, so if you found this video helpful, please like, share, subscribe, leave your comments, okay, and share it to spread awareness about PCOS and let people know that they're not alone in this condition. Thank you, and I'll see you in my next video. Bye. Choosing you care, staying for